Wonderful. So welcome this evening to our guests, our business partners. This is part 3 of our series, and our series is titled, Which Products Do I Use for My Customers? So if you are a customer, a guest on the line, this is a perfect platform for you. If you are a business partner here at Wakanna, this is a perfect platform for you too, so you can really understand which products that you should be advising, suggesting, recommending to your clients. So tonight we're going to talk about CBD. We're going to talk about what CBD is, how it works, and why we should use it. Right now, because this is part 3 of our series, I have about 15 or 20 or more scenarios that we're going to talk about, okay? So let's get started with our FDA disclaimer that these statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute or an alternative to information from your healthcare practitioner. Please consult your healthcare professional about potential interactions or other possible complications before using any of our products. The Federal Food, Drug, and Cosmetic Act requires that we read this disclaimer. So we are going to talk about, we're going to talk a little bit about me, who I am, and why you should even care. But I'm Dr. Rita McGuire. I'm an obstetrician gynecologist of 30 years. I trained at Wayne State School of Medicine in Detroit, Michigan. I completed my residency at Cook County here in Chicago. I'm CEO of RJM Wellness and Ripped Rita Fitness. I'm a global women's health and wellness speaker. I'm a certifying physician for the medical marijuana program here in Illinois. I'm a member of Doctors for Cannabis Regulation, as well as one of the co-founders and chief medical officer for Wakanna for Life. I'm also an owner of a Travis Garza Fat Loss Camp in South Florida, as well as an MBA candidate. I'm due to graduate in May of 2022, as well as I'm a trichology instructor candidate. I'm going to be graduating in the next 2 months. So exciting times, very, very busy, but I'm also a mom of 3 amazing children. Thank God they're not children, they're grown, right? I have a 30-year-old Jacob, 25-year-old Joshua, and a 23-year-old Hannah. So just one is left on the payroll. That's a baby girl. And as soon as she completes medical school, I will be home free. I'm still practicing as an obstetrician gynecologist. I'm on call every Wednesday night. You know, I'm here in the physician conference room. I still deliver babies, C-sections, hysterectomies, liposuctions. So just really enjoying my profession. Hope to retire very soon. But I'm an advocate for this plant. In fact, I was asked to testify in front of the Judiciary Committee for the state of Illinois. We're the 11th state to adopt adult use cannabis laws here in Illinois. So needless to say, my children think that I'm the coolest mom ever because I was one of those that was no to cannabis, right? I didn't understand the science behind it. I didn't understand all of the medicinal properties that this plant really does allow for all of us to have better health. So we are a movement. You know, when we speak about Wakanna, we're much more and bigger than a CBD company. My other 3 business partners, other co-founders are here. I want you to meet Dr. Patricia Van Pelt. She's our CFO. I want you to meet Phyllis Nash. She is our CSO and our visionary, our true, the person that made all of this happen and possible through her vision. Melissa Boston is our CEO. And of course, I am the Chief Medical Officer, the CMO. So we represent 4 pillars, the pillars of health, wealth, legacy, and freedom. So let's get right into it. Let's talk about this plant, right? Let's talk about the cannabis plant that still has a negative stigma. And that's part of our vision, is to end that negative stigma, to really help our communities understand that the health benefit is just amazing. And we're going to talk about the health benefit tonight. But the cannabis family has 2 species. One species is marijuana. That's a species that gives you the high, the euphoria, the paranoia, right? And it does that because it has high levels of a compound called delta-9 THC. That's what gets you the high. But then there's another part of the plant. It's called the hemp species. And it gives you the health without the high. And it does that by having very trace amounts of delta-9 THC. It has large amounts of CBD, but trace amounts of THC. So it gives you all the health benefits without being high. So tonight, of course, we're going to concentrate on the hemp species. All of our products are sourced from the hemp plant. So what is CBD? What is CBD? It's an abbreviation for cannabidiol, and it has a long list of medicinal benefits to the body. You know, it's an antibacterial, it inhibits cancer cell growth, and we're going to talk about cancer tonight. It's a neuroprotective. We're going to talk about a neural degenerative condition like dementia. It improves and helps and assists with those symptoms. It helps to promote bone growth. It reduces seizures and convulsions. It reduces blood sugar levels. It helps to reduce inflammation and pain. And we know that's a culprit in many chronic illnesses today, inflammation. It helps to reduce arterial blockage. We're going to talk about cholesterol and how CBD will assist with that as well. It helps to reduce small intestinal contractions. Those are conditions like ulcerative colitis and Crohn's disease, very, very debilitating and painful. It helps to reduce nausea and vomiting. You know, a lot of oncology doctors, cancer doctors are recommending CBD for their patients that have nausea and vomiting due to chemotherapy. It helps to relieve pain. It helps to relieve anxiety, depression, a lot of mental illnesses like schizophrenia. It helps to slow the growth of bacteria. And that's really, really widely used in hair products, in facial, topical products that can really help to assist with acne. It helps to suppress muscle spasms. And we're going to talk about muscle spasms, like in fibromyalgia. And it is very tranquilizing. It really just calms you. It just gives you balance, and it helps to dilate vessels. So it's a vasorelaxant, and that's why it's very helpful to reduce symptoms in those who have hypertension, high blood pressure. But there's other compounds, there's other cannabinoids as well that the plant makes that I think you should know about, like CBG and CBC and delta-8 THC and THCV. All of these cannabinoids have some of the same medicinal benefits as CBD. Some have a little different, but the synergy, when we bring them all together, what we call our full spectrum product, it absolutely has a response on a cellular level, which then gives a response to the body. And the response to the body that we're looking at, that CBD and other cannabinoids are able to do, is balance or homeostasis. And this is how CBD works. This is how cannabis works in our body. And it's through a science called the human endocannabinoid system. Every single human being has an endocannabinoid system. In fact, every vertebrate has an endocannabinoid system. That's why you see CBD for dogs and CBD for cats, right? You have a spinal cord, you have an endocannabinoid system. So when you consume CBD, it sends a message to different areas of the body, different glands, different organs. It sends a message to put the body in balance. The body may have a lot of inflammation, so it'll send a signal to reduce inflammation and pain, or maybe the body is unable to sleep at night, so it sends a pathway to release more serotonin and dopamine in the body. So all of these receptors, like CB1 and CB2 receptors that you see in this diagram, are a result of when you consume CBD, it binds and sends a message to the important part of the body that needs it. So how do you take CBD? You know, there's different forms of using CBD. You know, there's vape cartridges and vape pens. There's capsules. There are tinctures. There's topicals, and there are edibles. So let's look at some of these different ways of consuming CBD. I do want to let you know that all of our products come with a certificate of analysis where you can actually see the third-party validation testing that we do on our products to ensure that the product is safe and effective for internal use as well as topical use. In fact, we partnered with one of the top ISO labs that not only does testing for marijuana, but they also do testing in hemp, for hemp. And they're located in South Florida, so I'm able to frequent our lab because I'm in South Florida now every other week, just to ensure that our products are getting the appropriate attention. And I'm telling you folks, the instrumentation that is in our lab, because I say it's our lab, we're a partner, our top-notch instrumentation, right? And that's important to ensure that we have the highest quality of testing that we want to offer our consumers. So let's look at tinctures. Tinctures here at Wakanna come in two forms: our full spectrum or our power tincture. Those are the black label products. Those contain the legal limit of THC, Delta-9 THC, which is 0.3% or less. And then we have our broad spectrum or our pure tinctures. Those are the products that are in the white labels. Now, broad spectrum by definition contains less than 0.0% of Delta-9 THC. So these are products that we use on those who have random drug screens at their job. We also have a water-soluble product. That's a product you can put in your juice, you can put in your water, your smoothie, your oatmeal, any liquid. The Power water-soluble is a great product. And then we have other products that are directed for hair loss or hair thinning. That's our Empowered Hair. That's a product you can take as a tincture or a topical if you have random drug screens, as well as our Hempranium MD, and that is our most potent tincture. It's 900 milligrams versus 500 milligrams or versus 300 milligrams of CBD. We're going to talk about what condition you should recommend that Hempranium MD for. So these are our tinctures. You place them under the tongue. It takes about 30 minutes and some people 2 hours to get into the bloodstream. We recommend that you use 3 drops to start out with twice a day. Now you can always increase that for a maximum dose of 15 drops twice a day, but starting out with 3 drops twice a day is a great way to start the tincture. Placing it underneath the tongue, allowing that tincture to absorb in those glands, holding it under the tongue before you swallow, and then 60 seconds you can swallow. That will give you the optimum absorption of the tincture when you use it that way. Now, what affects CBD absorption? You know, a fat increases the absorption. Our CBD tinctures we use a carrier oil called MCT coconut oil. It is one of the best carrier oils that really helps to get the CBD effectively into the bloodstream. Taking CBD with food also can increase absorption. And taking CBD with other medications that you may be on, make sure you're spacing that CBD from your medications about 1 to 2 hours. Don't take them together, but space them. Why? Because many medications are metabolized in the liver the same way CBD is. So always spacing out your medications. We also talk about smokables. Our smokables either come in a cartridge, a pre-roll, or you can roll your own CBD joint with our premium flower. What I love about smokables is that they're fast acting. Within 10 to 15 minutes, you are feeling the effect of CBD. And that's why we talk about layering the products. That's why we really recommend, in many conditions, not all, that you always have a vape cartridge nearby for those acute onset of pain or anxiety. The vape cartridge and the pre-rolls are very portable. They address acute issues. And again, they are a great addition to the tinctures as well as the other products we're going to talk about. So we have our Power, our hypnotic vape oil. We have the Raspberry Jane cartridge. Again, all of these smokables will show up on a drug screen. So if you have urine drug screens, the smokables are not for you. We have Delta 8 cartridges, we have the CBD joint, and we have the CBD premium flower, because some people like to roll their own CBD joints, right? Some people like their joints tight, some people like them loose, and so those people can roll their own CBD joint. Gummies. Now, gummies are another way of consuming CBD. Gummies take about 90 minutes to get into your bloodstream. Why? It's got to go through the stomach, it's got to go through the liver, and then it gets to the bloodstream, right? So taking a gummy is not going to be for someone who has an acute onset of pain. You want to absolutely get that vape cartridge out, or that pre-roll, or that premium flower, and roll your CBD joint. Because gummies take about 90 minutes to get into the system, I recommend 30, 60, 90 minutes before you are going to go to bed, if you're using gummies for a restorative sleep, take it 30, 60, 90 minutes before you are going to retire at night. So we have broad spectrum gummies, our pure gummies. We have our power gummies, our full spectrum gummies. We have our Flight 50 and our Flight 25. Those are Delta 8. Delta 8 is the new cannabinoid on the block. It's a great cannabinoid for those who want a little bit more potency. We recommend with all of our gummies that you start out with a quarter or a half initially, and then work your way up until you find that sweet spot, that spot where it's really giving you the relief you're looking for. Topicals. Topicals are another one of my favorites. They're all my favorites. But we know about millions of people suffer from chronic pain. And so topicals are something that you want to have in your home, just like I used to have Motrin and Aleve. Now, I've not taken Motrin or Aleve, any of those over-the-counter medications, since 2017. That's when I was introduced to CBD. Instead, I use CBD topicals, CBD tinctures, CBD gummies, smokables for any discomfort that I have. Now, topicals offer local relief. Once you put it on, it starts to work within minutes. Again, it comes in different forms. It comes in a cream, which is our Power Extreme Relief, 400 milligrams, or it comes in a liquid, which is in a very convenient roller ball. I love carrying around my Dr. Rita's liquid rub because it's portable, it's easy. I like using the Extreme Power Relief at night so it can really soak in those sore muscles and joints that I've been working on every single day in the gym, right? So we have a proprietary formula where we also infuse essential oils with our CBD. And that's important to understand that essential oils help to reduce inflammation. They help to soothe and calm muscle spasms and cramps and joint discomfort. Those are our topicals. Capsules. Yes, we have a CBD capsule. It is our Power King Chaga. Chaga is a mushroom, chaga mushrooms. They have so many medicinal benefits. And when you put that with CBD and the long list of medicinal benefits that we talked about earlier, and this mushroom, it is just simply amazing. Now, capsules like gummies take about 90 minutes to get into the bloodstream. They've got to go through that same process through the stomach, through the liver, and then the bloodstream. I love this capsule form because there's quite honestly some people that don't like the taste of our tinctures. They can bypass the taste and swallow one capsule twice a day. One capsule twice a day. Each capsule is 25 milligrams of CBD. It is a water-soluble CBD. It has soothing properties. It helps to address ulcers, gastritis. It helps to normalize blood pressure and cholesterol. It has this mushroom has amazing antioxidative properties along with CBD. So it helps to reduce free radicals from tearing our body apart, right? And so the 6 main key ingredients that make this mushroom so beneficial are listed here. The polysaccharides, the beta-D glucans, the phytosterols, the butylin, the antioxidants, and the SOD. Those are super oxidase. These are superfoods. This mushroom is a superfood. It is just as powerful as turmeric, right? We all know about turmeric. Well, this is the new superfood on the block, the chaga mushroom, along with CBD. So now we're gonna move into, I've heard all this great information, Dr. Rita. I kind of understand now more about CBD. I understand that we're not talking about a product that's going to get me high because we're talking about hemp. I kind of understand how it works in the body, the endocannabinoid system. I understand there's different forms. There's vapes, there are capsules, there's topicals, there's edibles, and there's smokables. So I understand all of my different options, but let's look at some scenarios. Let's look at what it looks like when you're talking to someone, or maybe you're someone on the line tonight that has gout. You know, what are some of the symptoms of gout? Let me tell you, if you don't have gout, you are a blessed person, because I heard that it is very, very painful. Did I say very, very? Well, let me add another very to that. And it's sudden. Gout attacks are sudden. They're intense joint pain. Typically, the joint that they affect is that big toe, but it can affect the elbow. It can affect any joint, but typically it's that great toe. And then the lingering discomfort. After they get that intense attack, that pain just lingers long and long for hours. Typically, the joint is inflamed, it's very red, and because of that, they have limited range of motion. So let's go back and think about that wheel I showed you, right? All the benefits of CBD, right? It reduces inflammation, it reduces pain, right? Let's talk about some of the products that would be great for someone who suffers from gout. And we're not saying that these products are going to cure gout. What we're saying is that these products can assist with the symptoms of gout, right? That's why Dr. Rita made it a point to put the symptoms on these slides, because many of you are not doctors, and many of you may have friends that tell you, I have gout, and does this work for gout? And you'll be like, well, I don't know. I don't even know what gout is, right? So these webinars are just helping you to understand the symptoms that these products, right, can help with. So Dr. Rita's recommendation for gout, because we know the symptoms, right? Obviously, for the sudden intense joint pain, that person's gonna wanna have a smokable around. You're gonna wanna make sure they either have a vape cartridge, or they have a pre-roll, or they have the flower. Now remember, if that person has random drug screens, unfortunately, they wouldn't be able to use the power products. But we do have pure products, right? And we do have topicals. So that moves me to our tincture. Now, I recommend for gout the 500 milligram tincture, or if it's severe gout and it's really debilitating, our Hempranium MD. That's just our highest potency tincture. They have random drug screens, you would use the pure tincture, right? Now, for topical, I like the Dr. Rita's rub, and I like that for gout because typically the pain is sudden. You always want to have that person carrying around their Dr. Rita's rub so they can whip it out and put it on the area that's causing discomfort, right? And then the gummies. These people, I'm not going to use the word patients, but these customers, our friends, our families, they typically have a hard time sleeping because of that lingering discomfort, right? So at night, you want to ensure that they have a gummy, right? You want to start with a half. You may work yourself up to 1 or 2. It depends on that sweet spot. So those are the recommendations for those who have gout, symptoms of gout. These are not packages. I always mention that every single week. We do have packages, absolutely, but I'm giving you an idea of products that can be recommended for gout symptoms. Let's move on to neuropathy. Neuropathy is a peripheral nerve condition, right? And it is very common in diabetics. It's very common in folks who have had trauma or injuries to their nerves. The symptoms include numbness and tingling, localized pain. They can have loss of balance. They can have an abnormal gait. They can have cramps. They can have muscular weakness. They can even have gastric problems just from the peripheral nerve innervation in the stomach. They could have low blood pressure. The nerves can affect the facial nerve and cause a Bell's palsy. So neuropathy symptoms can be very wide range. So for neuropathy symptoms, of course, I would recommend the topicals. I recommend both topicals because with neuropathy, such a chronic long-term condition, you want to have a topical that you're applying at night. I love the 400 Extreme Power Relief Cream to apply locally at night. And then the Dr. Rita's rub that they can carry around and rub it on as needed. Also, I recommend black seed. Black seed is recommended for anyone that has any vascular nerve issues, right? Black seed has been shown to help improve inflammation, as well as help to improve blood glucose levels, cholesterol levels. So black seed is something that I recommend. And then the tincture, absolutely, either the pure or the power, depending on if they have a urine drug screen, 3 drops twice a day is where you start. Also, you can also, if they have a neuropathy that sometimes causes an acute onset, you can absolutely throw in a smokable. But typically, neuropathy symptoms are chronic, long-term symptoms that you can recommend these 4 products. Prostate cancer. This has been a question that has been coming up a lot. Prostate cancer, some of the symptoms include painful ejaculation, pain in the back, pain in the hips, pain in the pelvis that just linger. Blood in the urine or semen, pain on burning during urination, difficulty emptying the bladder completely, frequent urination, they're up at night, weak or interrupted flow in urine, and difficulty starting the urine. When the prostate gland enlarges, starts to press on the ureter, the tube that is emptying urine for the bladder. So they have a lot of issues with sexual ejaculation and urination. So obviously right out the gate, I recommend King of the Jungle. King of the Jungle is a great gummy that helps to address, by having CBD in it, it helps to address improvement in blood flow. It helps to address that painful ejaculation so that they can have more comfortable intercourse. I also recommend the Hemp MD. That is a tincture that is our most potent tincture, 900 milligrams, 3 drops twice a day is where I would start. And then for the pain in the back and the hips. And typically when they start having pain in the back and the hips and the pelvis, it's because the cancer has metastasized right to the bones. You want to keep them comfortable. The Power Extreme Pain Relief Cream, 400 milligrams, is absolutely a topical that would help them to maintain some comfort from joint pain. Cholesterol, high cholesterol. Now, high cholesterol typically doesn't have symptoms, right? But they can lead to problems. High cholesterol can lead to heart attack, can lead to stroke, can lead to atherosclerosis, coronary artery disease. It can lead to pain in the lower legs. It can lead to left-sided chest pain, right? So we absolutely know diet, exercise is what you want to incorporate before your doctor starts you on a statin medication. You want to incorporate the Power King with the chaga mushroom because all of the ingredients really do address cholesterol lowering as well as blood sugar lowering properties. Black seed addresses cholesterol as well. And then you also want to have the topical pain cream to address the pain in the lower legs or any other area that that person may have discomfort. Again, nothing substitutes a great diet and exercise. And that's what we really push here at Wakanna. I want to add that as well, that these products become very magical when we have the proper diet, the proper rest, the proper water intake, and exercise. Fibromyalgia. Fibromyalgia is an autoimmune disease, very debilitating. Last night, if you were on the call, Dr. Joseph Rosado, we spoke about the clinical deficiency of the endocannabinoid system. There is a deficiency that Dr. Ethan Russo did a lot of research in 2000 and found that migraines, fibromyalgia, and anxiety, depression are kind of 3 disorders that have definitely been linked to having low levels of cannabinoids or endogenous cannabinoids in our body. So fibromyalgia patients absolutely want to be on CBD. They have a lot of stiffness. They have a lot of fatigue. They have fatigue because they can't get to sleep. They have disruptive sleep, so they're exhausted in the morning. They have cognitive difficulties because they've got the brain fog going on because they didn't sleep well. They have multiple other unexplained symptoms, like anxiety. I would be anxiety and a little depressed, right? If I had fibromyalgia and didn't have something that gave me relief from the pain, from the stiffness, from the fatigue. So a lot of these symptoms really impair their activities or their daily living, activities of daily living, right? So things that we take for granted, like walking up the stairs or running up the stairs because we forgot our keys upstairs, these people have a hard time doing. So my recommendation for fibromyalgia symptoms, right, is the tincture twice a day, either the 500 milligrams or the hemp MD. I honestly I like starting with the hempranium 500 milligrams. And then if we find out that we've maxed out on that, then I would offer the hemp MD. The Power Extreme Pain Cream, as well as Dr. Rita's Rub. I like using the cream at night, letting it sit in. I like the Dr. Rita Rub to carry with me. So whenever they have stiffness or discomfort, they can roll it right on that joint. And then I recommend for fibromyalgia, our Flight 25, our Delta 8, right? These patients, people, friends, family, they need a little bit more of a potency for restorative sleep at night. So if they have random drug screens, of course, you would substitute the gummy and the tincture with a pure product. But if not, I recommend the Flight 25, the Power Extreme Cream, Dr. Rita's Rub, and hempranium 500 milligrams. Again, start the tincture with 3 drops twice a day. Start the gummy with a quarter initially, okay? So those are the new challenges that I wanted to bring up. If you've been on the call prior weeks, this is a recap of what we talked about. What we talked about for overall wellness, I recommend the customer variety package. This is a slide that shows that person you may know that has no pain, they sleep like a baby, they're on no medications, they're not ever anxious about anything, they are never depressed or worried, they are just happy people with nothing wrong with them, right? So for that person, you want to recommend our customer variety package. This will continue to help them to be in a very good state. This is a preventative package for overall wellness for that person who tells you they have nothing wrong, but you can educate them and let them know that the endocannabinoid system needs to be fed every single day. It needs to be kept in balance every single day, and these products will help do that. So this package, you get 2 Power Hempranium 500 milligrams, you get a Power Gummy 20 pack, you get 2 Pure Broad Gummies 4-pack, you get 1 Power Gummy 4-pack, you get 1 Power Extreme Relief Cream, the 200 milligram, the smaller one, you get 1 Hempowered Hair, which is the product that helps to maintain their healthy hair, and the 1 Power Relief Cream, the larger container, 400 milligram. Recommended use. So you get this package for that person who is just healthy, has no issues. I've met 1 or 2 people like this, right? They say they sleep like a baby, they have no issues. So I recommend that they use hempranium 500 milligram tincture, 3 drops twice a day. Use 1 pure gummy midday just to keep that overall calmness going on. The Hempowered Hair to areas that may start to thin, because as you get older, you have hair thinning. So twice a day with the hemp-powered hair in the affected area, and then one power gummy at night for sleep. Apply the topical power relief cream for inflammation or pain. So you can tell that person, instead of using BioFreeze or instead of using Advil or Motrin or Aleve, you have tools in your medicine cabinet that are organic and holistic that you can use instead. So that's how you sell it to them. Dementia is another area where CBD has been used for symptoms. Of course, again, I can't stress enough, we do not make claims that these products will cure dementia or cure fibromyalgia or cure gout or any other topic we've talked about, right? We're talking about assisting with symptoms. So what happens with dementia? They have symptoms of memory loss, mood swings, cognitive issues where they're trying to get their thoughts together. They're very many times confused. But one of the really very sad symptoms is something called sundowning or sundown syndrome. When the sun comes down, these patients, people, family members, friends, they start to get pretty aggressive, right? They get very irritable. And this will really help with that symptom as well as all of the other symptoms that those with dementia have. So I like the Power Water Soluble because if they have a cognitive dysfunction or issue where they can't hold a tincture under their tongue, you can put that Power Water Soluble in their water, their juice, their coffee, their tea, their smoothie. I recommend a gummy at night. And then if they want to have and can swallow, I recommend then using, instead of the Power Water Soluble, you can switch it up and use the capsule, the Power King Chaga, which combines the CBD with that chaga mushroom. So one capsule twice a day. So they can do either or, depending on their cognitive function. Kidney disease is another question. Some symptoms from kidney disease can be nausea, vomiting, loss of appetite, fatigue, weakness, sleep problems, changes in how much they urinate, a decrease in mental sharpness, muscle twitches, and cramps. These are my recommendations for those who have kidney disease, right? We can't tell anyone that these products will reverse their kidney function or these products will allow them to come off of dialysis. No, we are assisting with the symptoms. So some of the symptoms that include discomfort, dis-ease of joints and muscles, muscle cramps, and they get it a lot because when kidney patients go through dialysis, they're having all of those very important electrolytes removed, and sometimes they have an imbalance. So let's put their body back in balance with the Power Gummies, the Power Tincture, or the Pure Gummies or Pure Tincture, and the Power Extreme Relief Cream, and the Dr. Rita's Rub. So the cream, again, I like using at night. The Power Ball, I like using during the day. Reminder that these are not packages, these are recommended products. How about focus and energy? Get a lot of people that say, well, does CBD help with my focus? Or I need energy, I need energy. So we understand that all of this energy, focus, happens in the brain, right? And when the brain is out of balance, it needs that homeostasis. The brain and central nervous system has receptors, again, that respond to CBD. So we want to improve memory. We want to improve focus. We want to improve all of those things that CBD can aid in. My recommendation for energy and focus: peppermint spray. Peppermint spray is one of our essential oils that we offer here at Wakanna. I spray peppermint on the soles of my feet every morning. The soles of our feet have the largest pores in our body. It's natural energy. I'll also use a peppermint spray and use my hands as a diffuser and just inhale 1 or 2 times of natural energy. The Flat Belly Brew is a great coffee that's infused with CBD. 1 scoop with hot water will start your day off quite well as will help with weight management. The power gummies at night are essential to help you sleep. And then during the day, you can either use the pure or the power CBD, right? The tincture. You want to keep the body in balance. You want to get those receptors that are important in the brain for focus, for energy to be in balance. Last week, we had a guest on the line that wanted to know more about CBD and congenital heart disease. Congenital heart disease, obviously, you're born with that. Some of the symptoms are rapid heartbeat, rapid breathing, swelling of the legs, swelling around the abdomen, swelling around the eyes, extreme tiredness and fatigue, and a blue tinge to the skin because the blood flow is inadequate. Dr. Rita's recommendation for congenital heart disease, again, they're fatigued, they're tired. You know, the heart is just not many times getting the blood flow to important organs as it should. So peppermint spray will give them that natural energy. Hempranium, MD, is a great start for congenital heart disease patients. 3 drops twice a day. You want to make sure that they're monitoring their heart rate and their blood pressure because CBD is a vasorelaxant and can lower those 2 numbers. So making sure they're monitoring. Always, always recommend that your physician, their physician, understands that they are taking CBD so that physician can help to reduce and even remove a lot of the medications that they may be on. And then the Power Extreme Pain Cream for their cramps, for their muscle discomfort, for their chest discomfort, applying that topical as needed. Now, last but not least is our weight loss product, right? 4 billion people, they say, are estimated to be overweight or obese by 2050. We've got a lot already that are overweight and obese. We have products for weight loss. In fact, we have a whole package called the Gummy Challenge Package. It comes with the Flat Belly Gummies, it comes with the Flat Belly Brew, and it also comes with our bitter tea. These are the 3 very, very exciting products in that weight loss package. So we here at Wakanna recommend you start out with the 4-day detox bitter tea. Clean your system out. Get all the toxins out before you start your weight loss journey with us. Then you're going to use the Flat Belly Gummy, 1 Flat Belly Gummy about 15-20 minutes before each meal. It's going to allow you to have a reduction in cravings. It's going to help suppress your appetite. It's also going to help turn that white fat into brown fat. CBD does that, and when it does that, it improves your metabolism. It helps to reduce the visceral fat, the bad fat that are around your important organs. Also, you get an ebook. Our ebook that comes with this challenge gives you recipes, gives you a grocery list, gives you items that you should be eating. I recommend the Flat Belly Coffee Brew, 1 scoop with hot water once or twice a day. Will give you energy, and again, it will help curb those cravings for sugar and bad carbs. And get active. Do something. Join our rebounding at 8:30 every day with Dr. Ross. Join our workouts at 6 a.m. on Wednesday with Ernestine Davis and with Queen Neff and Dr. Roz. There's a whole community that really wants to help you to get active and get fit. So that's all for me. I'm going to take some questions. We have about 9 or 8 minutes to take questions. You can put your questions in the chat box there. Let's see what you have for me. Okay, let's start from the bottom. Thank you so very much for the suggestions for kidney disease. I probably won't need to ask those questions again. No worries, if you need to ask them again, you can. This is recorded. Thank you. Thank you for that. Someone said that was awesome, and it is recorded. The endocannabinoid system needs to be fed every single day. Yes, so you can look at CBD, especially in those folks who say they don't need it, they're healthy. They need to look at it like they look at a multivitamin, right? To keep the body in balance and to really help prevent anything from occurring down the line. You know, as we age, things happen. As we age, our hair thins, right? Our bones are becoming softer, right? So all of these preventive measures absolutely can be addressed with using CBD and keeping our endocannabinoid system in balance, in homeostasis. You love this series, thank you, wonderful. That's it, no questions? I guess I did pretty good this evening. So this is what we're gonna be doing. We're gonna be adding on. This is a 6-part series, right? So next week will be part 4. So you absolutely want to get your existing customers on the line, your new customers on the line, your new business partners on the line, and we're going to add on each and every week. So next week will be part 4 of the series of 6. Yes, so CBD product that's good for muscle cramps at night. I recommend for the muscle cramps at night, you use the Power Extreme Relief Cream. You really rub that cream in at night. You're going to use a gummy about 30, 60, 90 minutes before you go to sleep. Start with half a gummy, right? If you're doing the Delta 8, start with a quarter, but start low and start slow. You can always increase the amount. And then you want to have a smokable. A smokable product will help to relieve the cramps while the gummy is getting in your system. That's why we always talk about layering products, because as one is working and wearing off, because the smokables only last in your system for about an hour, then that tincture is kicking in, or that gummy is kicking in, right? So we always want to keep a steady state of CBD. So muscle cramps, the Power Relief Extreme Cream. You also want to use that gummy, 30, 60, 90 minutes. You're going to take that gummy before you go to bed to help with those muscle cramps. And then having a smokable product, 1 to 3 pulls is all you need on a smokable product. You don't need a lot. More is not better. Yes, the hemp-powered hair can be used as a tincture. You can put it under the tongue. If you have random drug screens, you want to use it topically. The hemp-powered hair is a great product to maintain your healthy head of hair, prevention, or you have issues with hair thinning, hair loss due to traction, due to weaves, due to braids. A lot of the autoimmune conditions causes hair loss and hair thinning. But what we're seeing a lot of, folks, is hair loss due to COVID. COVID hair loss is real. So you can really help a lot of people who have had COVID and now are looking for ways for their hair to get back to normal. So COVID hair loss is a really good one. Yes. So 4 minutes, the CBD help with diabetes. We're going to add that next week. CBD helps with diabetes and the symptoms that diabetes causes, because CBD is an anti-inflammatory. It helps reduce the inflammation in the pancreas. See, the pancreas is involved in producing insulin. So if the pancreas is not producing insulin appropriately, your blood sugar levels are going to be high. So CBD comes in, reduces the inflammation in the beta cells of the pancreas. I recommend black seed, that's our essential oil, because it also helps to rebuild the beta cells of the pancreas. So black seed and the Hempranium 500 or the pure tincture is where I would start with every single diabetic. So start with 2 products. That is the black seed oil, 3 drops under the tongue, along with the Hempranium 500 milligrams, 3 drops under the tongue twice a day. Wonderful. So what we're going to do is we're going to end it there. Ernestine, if you could email me your question. I am going to hop on another conference call. Prayerfully, there's nobody in labor tonight, so hopefully it'll be a nice, quiet night for Dr. Rita. We'll see you here next Wednesday. It will be part 4 of our series, What Do I Recommend, or what products do I recommend for my customers? See, I can't even remember the name of my series, but you know what it is. We'll see you next Wednesday. Be well, be safe. God bless you, and we'll see you next week. If you are a guest on the line, please connect with the person that invited you so that you can get these products in your hands immediately, right? So we want to get those shipped out to you. We want to get you back on the path of wholeness and wellness with CBD. Good night. We'll see you then.